Okay, we start binocular subjective refraction. Definitely, this is introduction part one. So, binocular subjective refraction and monocular subjective refraction. In case of monocular subjective refraction, in final stages, that binocular balancing, we use a little bit binocular procedure. Otherwise, always we occlude one eye, isn't it? So, in case of binocular subjective refraction, many of the monocular steps are same. Just remember, many of the monocular steps are same, but there is a crucial difference in why we love binocular single vision, sorry, binocular subjective refraction. So let's discuss. So basically, subjective refraction is term applied to the technique of comparing one lens against another using changing of vision criteria and arrive to the dioptrical lens combination result of maximum visual acuity with accommodation maximum possible rest. We know that. That's the subjective refraction. We have already discussed it. The conclusion of maximum visual acuity depends on the judgment and opinion of human subject being tested, isn't it? That's maximum visual acuity is judged by the human, that's patient. The resulting dioptric combination may not always represent the pure refractive state under the eye test. That's maybe happen, isn't it? Resulting dioptric combination may not always represent pure refractive status of eye under test. We know that. What is binocular refraction? So, clinical procedure in which subjective refraction is performed monocularly under binocular viewing condition. That's crucial. Just remember it. That's what we do. We do subjective refraction perform monocularly. We don't do both eye. We don't directly change the lens in both eye. Okay. We do monocular refraction. Sorry, subjective refraction monocularly, but that's a major difference. But under binocular viewing condition means another eye is open, not completely occlude. Another eye is seeing. Yes, details is different because of the techniques. Details are different, but both eyes are open. Yes, target are different. We know that because we are performing actually subjective refraction monocularly, isn't it? See, I want to you to look it like this. Can you look this as if there are two things? Clinical procedure in which subjective refraction is performed monocularly. So you can understand, isn't it? This blue line? But from this red line, can you understand under binocular viewing condition? That's centrally important. Okay, we perform subjective refraction monocularly, but another eye is not occluded, another eye is open, and another eye is also seeing something. Yes, which eye viewing which, that definitely depend upon the procedure. So situation is achieved, that situation monocular subjective refraction plus binocular viewing, isn't it? This situation is achieved by several methods, and that method we are going to discuss in several other videos. We can place septum, positioning of septum between two eyes. We can use polarizing target and polarizing lens maybe, and blurring vision in one eye such that each eye see only its respective target. Means one eye is blurred, consciously we make blurred but not totally occlude. Just remember that, not totally occlude. We can make another eye blurred by fogging too, isn't it? So these are the three techniques usually we do. So binocular refraction component procedure described monocularly and are merely performed in the same or similar manner. It means monocular we perform monocularly, but there are difference. So binocular refraction component definitely has monocular component too. So what is the difference? First, both eye are open. Second, both eye has something to do viewing common distance target. Yes, definitely. Like monocular, we do not occlude in binocular eye. We do not occlude one eye. Okay. So clinical indications of binocular, that's simply important to understand as an optometry student and as an optometrist. So what are the central clinical conditions for binocular refractions? So that's important. Okay. Uh, wait, wait. In case of refractive consideration, we are thinking like this. See, hyperopic anisometropia. Hyperopic anisometropy, one is the condition. Second, antimetropy. I think you know antimetropy, isn't it? Antimetropy, one eye is minus, another eye is plus. Sorry, one eye is myopic, another eye is hyperopic. And same goes for latent hyperopia. In case of latent hyperopia, if you do this refraction, binocular refraction, there is high chances of um, accommodation remains stable. Fourth, definitely in latent, so yes, definitely pseudomyopia. It's very important to understand these four conditions, refractive conditions we consider in case of binocular subjective refraction. What do we consider in visual acuity consideration? Means if two eyes are different visual acuity. I have already told you what that's condition. Anisoaxiopia, isn't it? Unequal visual acuity. Or second condition we prefer anisometropia, which causes to amblyopia. That's another condition, which condition we consider. And we don't know, maybe because of disease or whatever, it is decrease in visual acuity uniocularly. At that condition we consider this binocular subjective refraction. Or physiologically difference visual acuity. Okay, physiologically difference visual acuity. At that conditions, these four conditions, we prefer binocular subjective refraction. Okay, so what are the conditions in which ocular motility problematic consider, in which we prefer binocular refraction? First is always latent nystagmus, isn't it? Latent nystagmus means when you occlude one eye, then another, definitely nystagmus increases. At that condition, binocular subjective refraction is best, because that hidden latent component couldn't be manifest, isn't it? Another is cyclophoria. If there is a case of cyclophoria, just remember this binocular subjective refraction is very good. And other is whenever there is significant phoria, no matter what, high significant phoria conditions, binocular subjective refraction is best. Just remember these things. Okay, so this monocular viewing under binocular conditions, monocular refraction under binocular viewing conditions, may be achieved by several things. These are the three methods that we always prefer. Septum, by using septum, by using polarization, by using fogging, means decreasing vision of one eye, so that we can do subjective refraction monocularly, but viewing condition binocularly. That's what called binocular subjective refraction, isn't it? So in case of subjective septum, let's see, I'm going to discuss further introduction. I'm definitely going to delve into septum separately, and fogging separately, and polarization separately. But let's discuss about septum, fogging, and polarization for gross introduction. Okay, the concept originally discussed by Trivial. Each eye is view its respective target because of septums. So characters on the other side of the chart are masked from the view, because we use septum so that each eye view their own target. And both eyes see borders of the chart and septums, thus single perception. So what of the characteristics of the chart that actually gives the binocular vision, which is border of the chart and the septum. Border of the chart and the septums can be seen by both eye, but not target. Target they see separately. Okay, polarization. Polarization, analyzer and polarizer target have same axis and polarization, allowing right eye to view half of the target, but blocking the left eye to view the target, isn't it? If you see some target from right eye, then you cannot see same target from left eye, because left eye has another axis of polarization, right eye has another axis of polarization. That's why right eye see only the target from target which is meant to be seen by right eye, and left eye see only the target which is meant to be seen by left eye. So in this condition, the background is definitely common, and variation of this technique is to polarize the other letter and leaving the background normal. That's why in case background, what do we do? In background, binocularity is achieved, because background is seen by both eyes open. The technique is applied in vectographic slides. So another is fogging. This is very simple. The different approach is to monocular refraction under binocular condition. It slightly blurs central vision of the eye under not test. So which eye is not test, that eye we reduce visual acuity by fogging. Simply that. This slight blurring aspects of foveal vision such that each eye is refracted under the condition of binocular vision with the peripheral fusion, because central vision means the vision from the macula. We decrease the central vision, but peripheral vision is good. So peripheral fusion is there, which create binocular viewing conditions. In that condition, we are doing the monocular subjective refraction, and that's basically fogging. Fogging means to reduce visual acuity, central visual acuity of untested eye. That's it. So we will definitely discuss in another video about the procedure each by each. Okay, so basically this is the reference, which is basically clinical refraction, and I have definitely seen these things. So bis dann, tschüss.